Today, we're addressing a question that many people ask themselves. Do I have OCD? Obsessive-Compulsive Disorder is a complex condition, and recognizing whether you might have it is an important first step towards seeking help. In this video, we'll discuss the symptoms of OCD, how it's diagnosed, and what you should do if you think you might have OCD. OCD is characterized by two main types of symptoms: obsessions and compulsions. Let's break these down. Obsessions are intrusive, unwanted thoughts, images, or urges that cause significant anxiety or distress. These thoughts are persistent and feel difficult to control. Common examples include fear of contamination, worrying that you'll get sick or spread germs, even when there's no real danger. Doubts about safety, constantly questioning whether you locked the door or turned off the stove, even if you've checked multiple times. Unwanted aggressive thoughts, having disturbing thoughts about harming yourself or others, even though you don't want to act on them. Need for symmetry or order, feeling extremely uncomfortable if things aren't arranged in a specific way, or if something feels off. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. These actions are meant to reduce anxiety or prevent something bad from happening, but they often provide only temporary relief. Common compulsions include excessive cleaning or washing, constantly washing your hands or cleaning surfaces to the point where it interferes with daily life. Checking behaviors, repeatedly checking locks, appliances, or other things to ensure they're safe, even when it's unnecessary. Counting, tapping, or repeating actions. Performing certain rituals or actions a specific number of times to prevent something bad from happening. Seeking reassurance. Frequently asking others for confirmation that everything is okay, even when you know it is. Having occasional intrusive thoughts or engaging in certain repetitive behaviors doesn't necessarily mean you have OCD. The key difference is the impact these symptoms have on your life. For someone with OCD, obsessions and compulsions are time-consuming and interfere with daily activities, work, school, or relationships. They often cause significant distress and are difficult to control. For example, it's normal to double-check that you've locked the door, but if you find yourself checking it over and over again for an hour, unable to stop until it feels just right, this could be a sign of OCD. Similarly, having a fleeting thought about germs when touching a public surface is common, but if this leads to washing your hands repeatedly until they're raw, it might be indicative of OCD. If you're wondering whether you might have OCD, here are some questions to consider. Do you experience intrusive, unwanted thoughts that cause significant anxiety or distress? Do you feel compelled to perform certain actions or rituals to reduce your anxiety, even if they don't make logical sense? Do these thoughts or behaviors take up a considerable amount of your time each day, usually more than an hour? Do these symptoms interfere with your daily life, making it difficult to focus on work, school, or relationships? Do you try to avoid situations that might trigger your obsessions or compulsions? If you answered yes to several of these questions, it's possible that you might have OCD. However, only a trained mental health professional can provide a proper diagnosis. If you or a loved one is struggling with OCD, it might be worth trying one of our self-help courses at impulsetherapy.com. Created by OCD medical specialists, specifically for those suffering with OCD, over 97% of our users who have completed the course have seen a reduction in OCD symptoms. You can find out more at impulsetherapy.com. If you suspect that you might have OCD, it's important to seek help from a mental health professional, such as a psychologist or psychiatrist. They can conduct a thorough evaluation, which may include interviews, questionnaires, and sometimes even talking to family members to determine if you have OCD or another related condition. A professional diagnosis is crucial because OCD symptoms can sometimes overlap with other mental health issues, such as anxiety disorders, depression, or even certain personality traits. A clear diagnosis allows for the development of an effective treatment plan tailored to your specific needs. The good news is that OCD is treatable. If you're diagnosed with OCD, there are several effective treatment options available. Cognitive behavioral therapy, CBT. The most effective form of therapy for OCD is CBT, particularly a technique called exposure and response prevention, ERP. ERP involves gradually exposing yourself to the source of your anxiety while resisting the urge to perform compulsions. Over time, this helps reduce the power of obsessions and compulsions. Medication. In some cases, medications like selective serotonin reuptake inhibitors, SSRIs, can be prescribed to help manage OCD symptoms. These medications can help regulate serotonin levels in the brain, reducing the intensity of obsessions and compulsions. Support groups. Connecting with others who have OCD can be incredibly helpful. Support groups, either in person or online, provide a safe space to share experiences, learn coping strategies, and gain encouragement from others who understand what you're going through. If you think you might have OCD, it's important to remember that you're not alone and help is available. While OCD can be a challenging condition, many people successfully manage their symptoms and lead fulfilling lives with the right treatment and support. Don't hesitate to reach out to a mental health professional if you're experiencing symptoms of OCD. Early intervention can make a significant difference in managing the condition and improving your quality of life. Thank you for watching, and don't forget to subscribe to our channel for more information and support on OCD and mental health topics. If you found this video helpful, please like and share it to help others who might be asking themselves the same question. Remember, seeking help is a sign of strength, and taking that first step can lead to positive change.